and Super Specialty Hospital. She has also worked in Apollo Specialty Hospitals, Chennai. She has done her MBBS from Chengalpattu Medical College, her MD from Madurai Medical College, and she is a member of Royal College of Obstetrician and Gynecology. She has various publications in national and international journals. She has a special interest in high-risk obstetrics and gynec endoscopy. We welcome you, ma'am.
Good morning to one and all present here. At this outset, I'd like to thank the entire team of Cox for giving me this opportunity to present a talk on the ASSIST-2 study.
Sorry, sister.
Assisted vaginal birth. Assisted vaginal birth rates are falling globally with the rising cesarean delivery rates. This rate of decline in the recent years is in parallel with an increase in the rates of cesarean, especially in the second stage of labor. This is probably due to the increase in usage of instrumental deliveries owing to increase in maternal and neonatal complications associated with the usage of instruments, causing complications like OASI, increased need for NICU admissions due to low UPCAR, and soft tissue injuries to the fetus. There has been promising recent developments in assisted vaginal birth like the Odon Assist, which can save mothers and babies' lives across the world. The findings of the stage 2A of the ASSIST-1 study was published in 2021. Stage 2A of the medical study is defined as a small-scale study investigating device feasibility and techniques on the basis of the ideal framework to provide methodology for robust medical device research. Reported the feasibility of recruiting to intrapartum assisted vaginal birth research with initial data for 40 births. The device was used following UK guidance for all vertex presentations at station spines or below. None of the assisted births at station 0 spines were successful. The success rate of the Odon Assist was 48%, which was lower than the reported success rates of both vacuum and forceps. This low success rate was not unexpected, given that it was the first time that the device was used to expedite birth. As expected, there were important findings for optimal device use, device design, and clinical parameters. Notably, 10% of the devices were ineffective because of a manufacturing fault in the bulk pump mechanism for inflating the air cuff. So this was regarding the previous ASSIST-1 study. So the aim of the ASSIST-2 study was to investigate whether the safety and efficacy of the Odon Assist and the feasibility of data collection was sufficient for a future RCT. The objectives were to investigate the safety profile, evaluate the success rates of the Odon Assist, and to determine participant rates and reasons for non-participation, to determine their satisfaction with the Odon Assist, and to assess the feasibility of collecting outcome data. So this study was conducted aiming to investigate whether the safety and efficacy was sufficient to conduct a future RCT. What does this add to what is known? The study demonstrated that increased device understanding and improvements in technique was associated with higher success rates of assisted birth. So the sample size for the stage 2B was 104. So here I am demonstrating, there's a video clip of the demonstration of the device.
Is you put the cup inside the mother's birth canal onto the baby's head and put that in position like an advanced applicator, and this just gently allows the bag to slip around the baby's head, as you can see here. When it's got to the right position, which I can see about 0 here, I inflate the air chamber. You can see that inflating inside there. That just provides just a cuff around the baby's head. I can then withdraw the applicator. Then another couple of puffs just to make sure that we've got the right amount of air in. Now we wait for a contraction, okay? So she's got a contraction coming now. So as she's got a contraction, I just gently pull. And we can see we've got a blue line there, which means the baby's head is newly born. So as I do that, I just deflate the bag. And as I do that, and that the baby's head has been born. Then I can continue to help baby's body be born as normal. So as we can see from that demonstration, the plastic sleeve of the Odon device sits over the baby's head, and some women are concerned that this may However, at this stage of labour, the baby hasn't started to breathe yet, and is getting all its oxygen and nutrient supply from the mother's placenta. As soon as the baby's been born, the Odon device is removed, and the baby can take its first breath as normal. Also, the Odon device won't sit around the baby's neck, as it sits on the widest part of the baby's head, which is much higher up.
So as we can see from the video, this is the applicator with the sleeve which is being pre-assembled in the first picture. So the inserter is applied on the head of the body, and then we insert the plastic cuff which is being inflated, and then as soon as with a gentle pull, once the baby's head is delivered, the rest of the delivery is being conducted as usual. So the populations were the patients attending their antenatal visit to the Southmed hospital, with eligibility criteria being at least the patients have to be 28 weeks with less than 4 centimeters of cervical dilatation without any regional analgesia. So the key inclusion criteria was just said. The key inclusion criteria for allocating to intervention was all assisted vaginal birth had to have a specific clinical indication. The vertex was at 1 centimeter or more below the spines, and it had fulfilled all the requirements of the RCOG guidelines for assisted vaginal birth. The key exclusion criteria were maternal reported fetal skull abnormalities, fetal osteogenesis imperfecta or any fetal bleeding disorders, IUDs in the current pregnancy. Now coming to the study design, the stage 2B study of the Odon Assist for 104 participants requiring assisted vaginal birth was undertaken. Data was also collected from a nested cohort who had consented to participate but whose delivery was expedited using forceps or ventouse because of unavailability of the Odon Assist operator. So after assessing 2,600 people for eligibility, 941 consented, and they were allocated into 2 groups, 104 in the Odon Assist and 22 in the nested cohort. Now coming to the outcomes, the primary outcome was the proportion of births successfully assisted with Odon Assist. A birth was defined as successful if it was expedited only with the Odon Assist and there were no serious maternal or neonatal adverse reactions. Secondary outcomes included metrics related to study feasibility, maternal and neonatal characteristics, and device safety. Neonates were followed up until day 28 and mothers until day 90. All neonatal injuries were assessed by a consultant neonatologist to determine whether it was related to the device. The births were conducted by 13 obstetricians who had undergone specialized training. If the Odon Assist was unsuccessful, the obstetrician used their clinical judgment to complete the birth, either using a second Odon device, a ventouse, forceps, or cesarean. All the devices were immediately examined after use by a member of the research team and manufacturing team. The key findings of the stage 2B of the Odon Assist device was the success rate was found to be 66% with low adverse maternal and neonatal outcomes. There were potential advantages for neonatal outcomes with only 4% of the successful Odon Assist group experiencing any device-related adverse effect in the form of a neonatal soft tissue bruising as opposed to 20 and 23% in the Odon Assist failed group and in the nested cohorts. So a little more explanations on the primary outcome. The hold-on assist was successfully used in 66% of births. In one of these, a second device was used after failure of the first. There were no serious maternal or neonatal device-related reactions. Additional assistance was required to complete the birth in 34% of the cases. This was either by non-rotational forceps or a rotational forceps in 9% cases, 3% in ventus, and 3% requiring emergency cesarean delivery. This has been explained. Just looking at the percentage, we can see that the significant rates of cephal hematoma, grazing, bruise, and laceration in the neonate was found to be very less. It was only like only one child had experienced a cephal hematoma, 7 had experienced a graze, and 3 had knee laceration. So coming to the conclusions, the BD hold-on device is a tool to assist vaginal delivery during the second stage, need for more cesarean sections, reducing maternal and fetal morbidity and mortality in low resource settings. Research concerning the device is still in its initial steps. Until date, there have only been 5 studies, 3 in models, 2 in humans. And these studies have concluded that the device seems easy to use, safe and effective, and it may be a good alternative to vacuum or forceps. There is a study protocol of its use in arrested second stage, which will later be published. So the study requires more research concerning the device, which is expected to take place in the near future. Thank you for giving me this opportunity. We had participants who had a previous normal vaginal birth who were also willing to take part in the study, even though they had no proper indications for assisted vaginal birth. They were just willing to participate in the study, and other primees were also there in the control group.
You mean that second hold-on assist device means second time a new
device was used.
Fresh device has to be used?
Yes, ma'am. There was only one patient requiring the use of a second device, unlike the initial assist one study which had a couple of more numbers requiring the use of second device.
What I mean is, for the first assist device, the vacuum will not be there.
The
it
first
has to be discarded and next device has
yes,
to be
ma'am. A new device had to be used because there was a fault in the first device.
Probably this device is designed for application by midwife it seems.
Yes.
No, probably that would be the reason, because I think that would be the one advantage over a ventus. Being a midwife can apply with it.
Precautions for sterilization, for how much interval you should use for other next subsequent deliveries? Any protocol for that?
There has been no specific
protocol. Okay. Just a valid study, yeah. Nice.
Thank you, Priya.